Welcome back to Breastfeeding Nurtured with a tagline, the first step to lifelong health. Today, in session 12, Breastfeeding, how to increase, sustain, and relactate, we will address one of the most common and concerning challenges for mother. That is, how to increase milk supply, sustain it over time, and even relactate when breastfeeding has been interrupted for any reason. Before we dive into the first slide, don't forget to subscribe to my channel by simply scanning the QR code as shown. Stay informed with the latest breastfeeding best practices. Don't miss out. Join us today. Let's get started with our first slide. In the present session, we will be covering three major aspects: how to increase milk production, how to restart breastfeeding when it has been stopped or reduced, that is, relactation, and finally, how to support and sustain breastfeeding for the long term. Initially, we will focus on the techniques to build up milk supply, especially when a baby is willing to feed at the breast. We will also explore practical tools like the breastfeeding supplementer. Later, we will shift our attention to how to help mothers maintain breastfeeding for up to 2 years or beyond, in line with global recommendations. This includes emotional, practical, and health system support. Together, these strategies form a strong foundation for breastfeeding success in the short and long term. This knowledge is important for both new mothers facing feeding challenges and for health workers who support them. Let's now understand when and why a mother may need to increase her breast milk or relactate. If her milk supply has reduced, often due to challenges with breastfeeding, it becomes essential to rebuild it so the baby receives enough nourishment. At times, a mother may have even stopped breastfeeding entirely but wishes to resume. This process is known as relactation. There are various situations that can lead to this. For instance, if the baby was unwell and couldn't feed, or if the baby was being given formula and now the mother wants to return to breastfeeding. Some babies may not do well on artificial feeds, prompting the mother to reconsider breastfeeding. Sometimes the mother herself may have been ill and had to pause feeding. In other cases, a woman may be trying to breastfeed an adopted child or take over care during a crisis, like a natural disaster where babies are orphaned or separated. Interestingly, the techniques used to increase milk in mothers with low supply are also applicable to those attempting relactation. However, relactation is typically more demanding. It takes patience, consistent effort, and a lot of emotional and practical support. And in some cases, when the baby is not accepting the breast, we may need to apply the approaches discussed in the session on breastfeeding refusal. Let us now understand the most effective ways to help a mother increase her breast milk supply, starting with what truly works and clearing up common myths along the way. Frequent suckling is most important factor in increasing milk supply. The baby's suckling stimulates the release of prolactin, the hormone responsible for milk production. Without frequent stimulation, milk supply cannot increase regardless of other efforts. We have discussed it in detail in session 3 on understanding dynamics of productions and intake. Now, frequent feeding alone is also not enough. Proper attachment ensures that the baby suckles effectively, drawing milk and stimulating the breast adequately. We have already discussed in session 3 how poor latch leads to poor milk transfer and reduced breast stimulation. Moreover, supporting the mother by helping her establish a regular feeding schedule, improving positioning and latch, encouraging skin to skin contact, and creating a calm feeding environment reinforce both supply and the mother's confidence. A relaxed and confident mother is more likely to have successfully breastfeeding experience. Emotional well-being improves oxytocin release and promotes milk letdown. Rest, emotional support, and gentle reassurance go a long way in helping mothers breastfeed. Breastfeeding increases a mother's thirst, especially during or after a feed. Mothers should drink to satisfy their natural thirst, but forcing excess fluids does not increase milk production. A well-nourished mother does not need to eat extra to increase her supply. However, undernourished mothers should be encouraged to eat better to regain strength, not because food itself stimulates milk. Now, in many cultures, lactogogues are recommended, which are a special food, drink, or herbs believed to increase milk supply. While these don't act like medicines, they may help by making the mothers feel supported, confident, and cared for. This emotional comfort can positively affect milk flow. To help a mother increase her breast milk supply, we must provide consistent support, practical guidance, and reassurance, step by step, as discussed in the next three slides. Initial support can make a vital difference in maintaining a good breast milk supply. Helping a mother increase breast milk supply begins with offering support at home along with consistent guidance and encouragement. However, if challenges persist or there's a risk of reverting to bottle feeding, a short hospital stay may help, but only where skilled lactation support is available. To identify the cause, gently explore why her milk production may be low. It could be ineffective latching, stress, illness, or prior bottle use. Encourage her daily and keep reminding her that with dedication, she can rebuild her milk supply. Frequent positive words will help strengthen her confidence in producing enough breast milk. Emphasize the need for a balanced diet and proper hydration. Without enough energy intake, milk production can be compromised. If there's a culturally accepted food or remedy believed to enhance milk supply and it's safe, encourage her to use these trusted galactagogues. Remind her to rest adequately and stay calm during breastfeeding. Tension can inhibit the milk letdown reflex, so she needs to be calm. Continuing further, skin-to-skin contact and frequent feeding are key factors in increasing breast milk supply. Closeness matters. Keeping the baby nearby throughout the day boosts bonding, triggers hormonal release, and helps establish feeding cues. Encourage mother to frequently breastfeed at least 10 times a day. This frequent stimulation is crucial to signal her body to make more milk. The mother needs to offer the breast every 2 hours and whenever the baby seems interested. The baby doesn't have to cry to signal hunger. Allow the baby to suckle longer than usual, switching sides once the breast feels empty. Night feeds are vital as hormonal surges at night. This helps with milk production. Keeping the baby close at night makes it easier to feed frequently. Babies may latch more easily when they are sleepy or in light sleep. Take advantage of such moments. While supporting a mother to increase her breast milk supply, it is essential to focus on proper feeding techniques and closely monitor the baby's progress. A good latch ensures effective milk removal and stimulates production. Review and guide her on this if needed. Avoid nipple confusion by advising against pacifiers and bottle use. Teach the mother how to offer any needed supplements via cup. Supplement during suckling if the baby wouldn't nurse on a seemingly empty breast. Assist the mother in using a dropper or lactation aid that delivers milk while the baby is at the breast. We will explore this in more details later in the session. For formula reduction plan, begin with the baby's current feed volume or 150 ml per kg per day. As the milk supply improves, gradually reduce the supplement by 30 to 60 ml daily. Track progress by regularly checking weight gain and number of wet nappies to assess if the baby is feeding well. If the baby isn't gaining weight, pause reduction in supplements or even increase temporarily. Some mothers may be able to taper off faster than the standard rate. The pace at which breast milk supply increases differs widely. Mothers who are highly motivated and have babies willing to suckle frequently often see quicker results. However, reassure the mother not to feel discouraged if progress seems slow. It's normal and still achievable. Confidence and persistence are key. If the baby is still latching occasionally, even a few times a day, milk production usually picks up within several days. If the baby has completely stopped breastfeeding, it may take a week or two or even longer for milk to reappear. Relactation is generally more successful when the baby is under 2 months of age. The younger the infant, the more easily they tend to return to the breast and stimulate milk production effectively. If breastfeeding was stopped only recently, reinitiating it tends to be easier. But even if a long time has passed with support and consistent efforts, it's still possible. Remarkably, milk production can restart even after many years. In special cases, post-menopausal women, including grandmothers, have successfully breastfed, especially with a strong emotional motivation and sustained stimulation. In some cases, when a mother's milk supply is low, a breastfeeding supplementer can be a useful tool to continue feeding at the breast while stimulating milk production. A breastfeeding supplementer is a device that allows a baby to receive extra milk, either expressed breast milk or formula, while suckling at the breast. It's post breastfeeding when the mother's milk supply is insufficient. A baby may not want to continue suckling at the breast that appears empty, especially if they have had experience with bottles. This frustration may cause them to stop trying altogether. Using a supplementer allows the baby to get milk during breastfeeding, which keeps them interested in suckling. This ongoing stimulation is essential to signal the body to produce more milk. By offering supplements directly at the breast, the need for bottle feeding is avoided. This prevents nipple confusion and encourages breastfeeding behavior. This method is particularly helpful when trying to re-establish breastfeeding or when working to build up supply in situations like adoptive breastfeeding or after early weaning. Let's now see how a breastfeeding supplementer is used to provide additional milk while keeping the baby at the breast using simple equipment like a small cup of milk, a fine feeding tube, and medical tape to secure it in place. Prepare the tube by cutting off any characters from the tube. At the end that goes into the baby's mouth, add a small hole to the side in addition to the tip opening. This helps milk flow more easily during suckling. Position the tube by asking the mother to hold one end of the tube along her breast such that it reaches the baby's mouth right alongside the nipple. Secure the tube in place with tape. The other end goes into the cup of the milk. Explain that as the baby suckles at the breast, milk is gently drawn through the tube, just like sipping through a straw, allowing feeding and breast stimulation to happen at the same time. This dual benefit of feeding and stimulating the breast helps reinitiate and maintain milk production. To control the milk flow, raising the cup increases the flow speed, whereas lowering it slows the flow down. If the flow is too rapid, which can reduce breast stimulation, tie a small knot in the tube or use a paper clip or finger pinch to regulate it. The outcome is that as the mother's breast milk supply increases, the need for supplementation decreases, and the supplementer can eventually be stopped altogether. Now that we have seen how to set up and use the supplementer, let's discuss what type of milk to be used and how much milk is to be given. Express breast milk is the first choice as it maintains the baby's familiarity with human milk and supports immune protection. If breast milk is not available or insufficient, use infant formula appropriate for the baby's age and nutritional needs. The daily requirement for the baby who is not breastfeeding at all is approximately 150 ml per kg of body weight. Divide this amount by the number of feeds per day, for example 8, 10 or 12 feeds to get the volume per feed. Add a small buffer that is 5 to 10 ml to account for spillage or tubing loss. As breast milk supply increases, gradually reduce the supplement volume by 30 to 60 ml per day, monitoring baby's weight and urine output closely. Here are some simple alternative ways to offer supplements at the breast when the baby doesn't suckle well or the mother finds the supplementer difficult to use. Use of syringe with tubing as a controlled delivery tool where 5 ml or 10 ml syringe is fitted with a short length about 5 cm of fine tubing which can be adapted from a feeding tube. The mother can fill the syringe with milk from a small cup and gently insert the tube into the side of the baby's mouth. She slowly pushes the milk as the baby suckles and repeats until the feed is complete with the aim to stretch feeding time to around 30 minutes, that is 15 minutes on each side if possible. Another method is to use a dropper for small amount of milk while the baby suckles. The mother fills the dropper with milk and lets it dip into the baby's mouth when the baby is suckling at the breast. This simple method requires less equipment but still encourages suckling and stimulation. Dripping milk on the breast to encourage latching is another method where a mother can use a spoon or cup to drip milk directly over the nipple and breast. The baby is then positioned to lick or lap up the drops. Once entrusted, the nipple is gently introduced into the baby's mouth to encourage attachment. This may need to be repeated for a few days before the baby starts suckling effectively. As discussed earlier, a baby may need extra milk during relactation, which can be provided using a supplementer at the breast or through cup feeding. Now let me walk you through a couple of real life scenarios that explain the concept of supplementing while a mother is relactating. To begin supplementing, first calculate the total amount of milk the baby requires. A baby typically needs 150 ml per kg body weight per day. For example, a 4.5 kg needs 675 ml per day. This ensures the baby's nutritional needs are met while the relactation process begins. Let us look at another example where a grandmother is using a supplementer for relactation. The grandmother breastfed her own children and is now willing to relactate for her grandchild who is 4 weeks old and weighs 4.5 kg. She begins by giving 675 ml per day of formula milk using a supplementer while the baby suckles. As she starts producing milk, she reduces the formula by 30 ml per day while allowing the baby to breastfeed frequently. This gradual reduction encourages the baby to suckle more and help increase natural milk production. Now let's have a look at another scenario where donor milk is used with cup feeding. This is a 2-month-old baby weighing 4 kg who has been bottle fed for a month and is now ill with diarrhea. Her mother had breastfed successfully earlier and is willing to relactate. You will give 600 ml, which is based on the requirement of donor express breast milk daily by cup, and begin reducing it by 30 ml per day as the mother's milk supply increases. On day 1 of reduction, the baby should receive 570 ml of express breast milk. With a daily reduction of 30 ml, the volume decreases to 300 ml by day 10. By around day 20, cup feeding is usually phased out completely. If feeding 10 times a day, each feed should be approximately 30 ml, but 35 ml should be poured into the cup to allow for spillage. We understand that a gradual transition to exclusive breastfeeding supports both the baby's nutritional needs and the process of relactation. With consistent breast suckling and a step-by-step reduction in supplementary milk, most mothers can successfully rebuild their milk supply. Encourage patience, close follow-up, and continued support throughout the process. As we conclude this session, let me share two images that illustrate how a breastfeeding supplementer can be used effectively during relactation. Image 1 shows a mother nursing her baby with the help of a breastfeeding supplementer. Notice the small cup containing formula milk and the thin tube running from the cup to her breast and into the baby's mouth. Image 2 is of another mother using a similar supplementer setup. You can clearly visualize how the tube attached to the syringe is positioned and how the baby is latched onto the breast while receiving milk from the supplementer. Before moving on to sustaining breastfeeding, here's a quick overview of induced lactation for you to explore further. Frequent and consistent suckling by the baby has a very important role, which is often supported by a breastfeeding supplementer to gradually stimulate milk production over a few weeks. For many women, especially those who have adopted, this process can be emotionally fulfilling and help them experience the nurturing aspect of motherhood. The amount of milk produced through induced lactation differs from one woman to another. Complete breastfeeding may not always be possible as the breasts have undergone the hormonal preparation that occurs during pregnancy. In some cases, hormonal treatments are used, but these lack strong scientific backing. In relactation or induced lactation, mixed feeding, that is formula plus breast milk, may sometimes be necessary. In regions with high HIV prevalence, this practice poses additional risk as mixed feeding increases the chance of HIV transmission. Mothers considering relactation should be offered HIV counseling, testing, and follow-up. If HIV positive, mothers should be guided to make informed decisions about feeding practices, including the options not to relactate. Certain medications like domperidone or metoclopropamide may be prescribed to help increase milk supply by boosting prolactin levels. However, these should only be used when milk is being removed regularly, either through suckling or expression. They are not effective on their own and should not be used as a routine measure. A woman who has never been pregnant or breastfed before can produce breast milk for an adopted baby. This process is known as induced lactation. While this may seem surprising to some, it is medically recognized phenomena, though it may require time and dedication. Let's now discuss how to sustain breastfeeding, a crucial phase where ongoing support empowers mothers to continue breastfeeding for up to 2 years or beyond, in line with global health recommendations. In this session, we will be exploring how to apply the knowledge and skills covered so far to support mothers in following global recommendations, which include exclusive breastfeeding for the first 6 months, followed by continued breastfeeding up to 2 years or beyond, along with the timely introduction of appropriate complementary food from 6 months onwards. Despite these well-established recommendations, many mothers are unable to follow them fully. In several communities, exclusive breastfeeding is discontinued early, or breastfeeding is stopped altogether within a few weeks or months. This often happens not because mothers lack the will, but due to challenges they face, such as cultural influences, the pressure to return to work, or unsupportive healthcare environments. Recognizing these barriers is the first step to helping mothers overcome them and sustain breastfeeding successfully. To ensure that more mothers can continue breastfeeding as recommended, we must create a supportive environment that goes beyond the health sector alone. To help more mothers breastfeed according to the global recommendations, we need a supportive environment built through public education, community engagement, and cross-sector collaborations. School curricula, media, and civil society can all help normalize and promote breastfeeding. Where possible, collaboration with sectors like education, social welfare, and women's empowerment can foster stronger advocacy and actionable strategies. Mothers groups, whether formal or informal, are powerful tools for peer encouragement. Health workers can identify existing groups, help initiate new ones, provide reliable information, offer training, and establish a referral system to and from these groups. Most importantly, the role of health workers, both at health facilities and in the community, is pivotal. Their encouragement and guidance must be woven into routine care. Without active support, even unintentional inaction or misinformation may negatively affect a mother's confidence and breastfeeding success. Sustaining breastfeeding requires not just a good start at birth, but regular, well-timed support that needs the mother, whether they are at home, in clinics, or in the community. Initial baby-friendly practices during birth, such as skin-to-skin contact and early initiation, set the foundation, but ongoing support is equally vital. Sustaining breastfeeding requires structured follow-up. Studies have shown that frequent support from trained health worker or peer counselors significantly increases the likelihood of mothers continuing to breastfeed. Importantly, this help should be planned and predictable. We shouldn't wait for problems to arise before stepping in. Instead, health workers should proactively reach out during antenatal visits, immediately post-delivery, and in follow-up care. Each of these opportunities is called a contact, regardless of whether it happens in the hospital, clinic, or home. The tasks during these contacts, assessing breastfeeding, counseling mothers, and addressing early concerns, are universal and should be clearly defined as part of the health workers' responsibilities. This slide presents the concept of a standardized sequence of breastfeeding support contacts aimed at sustaining breastfeeding practices over time. While these contacts can be tailored to align with local policies, consistency within each setting is essential. Many of these contact points are already embedded within the existing initiatives, such as baby-friendly hospital initiative or child survival programs. To be effective, these contacts must form a continuous support chain with clearly defined roles and responsibilities, delivered by trained personnel at both the facility and community levels. The first contact begins during the antenatal period, ideally across 2 visits. These focus on counseling the mother about breastfeeding benefits, early initiation and skin-to-skin contact, while addressing her concerns and building confidence to prepare her for successful breastfeeding. The second contact occurs immediately after birth and is crucial for initiating breastfeeding. Placing the baby on the mother's bare chest promotes skin to skin contact, triggers natural feeding instincts, and allows the baby to self attach and suckle, which is essential for stimulating milk production and bonding. The first two postnatal contacts on day 1 and between days 2 to 4 are essential to ensure effective breastfeeding. The health workers should observe feeding, assist with positioning and attachment, address concerns like sore nipples or milk supply, and offer counseling and follow-up support. Early reassurance helps prevent common issues and reinforces exclusive breastfeeding. The postnatal contact between days 5 to 8 reinforces earlier support. The health workers reviews feeding patterns, checks weight gain, observes the feed, and provides guidance to correct any deviations from exclusive breastfeeding. The postnatal contact between 14 to 28 days focuses on follow-up, assessing feeding adequacy, addressing issues like slow weight gain or engorgement, and reinforcing exclusive breastfeeding during this still vulnerable period. The 6 to 8 weeks postnatal contact aligned with the mother's postpartum checkup is a key opportunity to assess weight gain, ensure breastfeeding is well established, address any issues, and encourages continued exclusive breastfeeding up to 6 months. Breastfeeding support should continue beyond the early weeks through ongoing contacts during immunization, illness, or family planning visits. Each encounter is a chance to reinforce feeding practices, introduce complementary foods from 6 months, and support continued breastfeeding up to 2 years or more. Proactive structured guidance, even without problems, improves breastfeeding success, especially for mothers with special needs, including those living with HIV. Now, this slide discusses how trained health workers and peer counselors workers contribute to sustaining breastfeeding over time. Their consistent skill support greatly enhances a mother's confidence and ability to continue exclusive and later continued breastfeeding. However, to ensure the quality of this support, it is essential that these providers are well trained, regularly supervised, and supported in their roles. In the previous slide, we discussed more than 7 contact points. These contacts form the backbone of sustained breastfeeding support and should be seen as a connected sequence, not as isolated events. Many of these contacts are already integrated within programs like Baby Friendly Hospital Initiative or Newborn Survival Efforts. Depending on the setup, different health workers, whether in hospitals or at the community level, can carry out these contacts. In some places, peer counselors trained specifically in breastfeeding support take on this role effectively. While the exact timing of each contact may vary by local policy or health system structure, what matters is consistency. The same contact plan should apply to all mothers within a district or a country. It's important to clearly define what tasks need to be done at each contact point to make it purposeful. Document each completed contact in the mother's or infant's health records for accountability and follow-up. Above all, mothers should be reminded that frequent and effective suckling is the single most important factor to increase and maintain their breast milk supply. This slide highlights how job aids can support health workers in delivering consistent and effective breastfeeding guidance during postnatal contacts. Simple job aids help health workers remember key tasks during postnatal contacts. These tools act as checklists, ensuring no important step is missed during each visit. A small reference booklet can guide consistent, effective support that outlines what to assess and discuss during every postnatal contact. Growth monitoring provides a natural opportunity to discuss breastfeeding and ensure the baby is feeding well and thriving. If a baby is not gaining weight adequately, It may signal that the mother-baby pair needs help with breastfeeding. Even if weighing isn't possible, simple observations like whether the baby is alert, active, and passing urine can give a good sense of how well breastfeeding is going. In this slide, we will discuss the components of a jaw bed used during postnatal contacts. The first section outlines how health workers should approach and structure postnatal contacts using the jaw bed. Apply listening, learning, and confidence building skills through respectful communications and active listening to build trust and open dialogue with the mother. Review previous findings and ask relevant questions by referring to earlier visits, following up on the past issues, and tailoring questions to the mother's current situation. Observe the mother, the baby, a feeding session, and growth indicators by assessing their general condition, watching a feed if possible, and checking weight or length to monitor growth. Next section covers key areas during postnatal context by discussing essential topics that ensure holistic breastfeeding support for both mother and baby. Assess breastfeeding progress, feeding frequency, and any supplementation by asking how often the baby feeds, how well feeding is going, and whether any bottles, formula, or other fluids are being given. Assess the baby's health behavior and the mother's condition by observing the baby's alertness, sleep, urine output, and overall well-being, along with the mother's physical and emotional state. Explore support at home, work, and family dynamics by discussing the help available to the mother or any family pressures are there and challenges she may face in returning to work. Next section covers about providing support and guidance by offering practical help and reassurance tailored to the mother's needs during each postnatal visit as detailed. Assist with positioning, attachment, and milk expression by observing a feed and providing hands-on support or demonstrations to improve breastfeeding technique when needed. Reinforce the principles of exclusive and responsive breastfeeding by reminding the mother to feed on demand and avoid supplements unless medically necessary. Address any concerns such as low milk supply, poor weight gain, sore nipples, or refusal to feed by responding empathetically and offering appropriate reassurance and solutions based on the observations. Refer if complications persist by ensuring timely referral to a skilled provider or facility when issues cannot be resolved at the current level of care. We will now discuss the use of job aids by health workers during ongoing contacts beyond early postnatal period, that is more than 6 to 8 weeks, to provide consistent, comprehensive infant care, thereby ensuring continued guidance for breastfeeding and infant support as the baby grows. Apply counseling skills using listening, learning, and confidence building techniques to engage the mother and build trust. Follow up on previous contacts by reviewing earlier observations and continuing the conversation based on past questions or concerns. Assess through questions by asking about breastfeeding progress, frequency, duration, comfort, and breast condition. Any use of fluids, bottles, or pacifiers. The baby's health and behavior, the mother's well-being, and family planning. Past feeding experiences and available support at home or challenges related to work. Observe the baby's overall condition and alertness, the mother's physical and emotional state. Breastfeed if concerns are present, focusing on latch, positioning, and breast health. And monitor growth by checking weight or length or height where feasible. Discuss and educate by reinforcing exclusive breastfeeding until 6 months. Guide the introduction of complementary foods using AFATVRHF framework, that is age appropriate, frequency, amount, thickness, variety, responsive feeding, and hygiene. Encouraging continued breastfeeding up to 2 years or more, highlighting the importance of family support, exploring family planning options, and helping mothers prepare for returning to work. Respond to challenges by addressing concerns such as poor or excessive weight gain, insufficient milk, persistent crying or feeding refusal, and breastfeeding difficulties like sore nipples, engorgement, or mastitis. In ongoing contexts, job aids help health workers maintain consistent and structured support for breastfeeding and childcare. These tools guide what to observe, ask, and discuss, ensuring that breastfeeding remains on track. Complementary feeding is introduced correctly, and any emerging difficulties are managed or referred. By building on previous visits and engaging both the mother and family, we can provide tailored care that evolves with the child's growth and the family's need. Health workers are often the most trusted source of information for mothers. During routine visits, whether it's for immunization, weighing, or illness, there's a natural opportunity to reinforce breastfeeding practices. However, what often happens is that if everything appears fine, the health worker may say nothing, but silence can be misinterpreted. A mother may think she's doing something wrong or feel unimportant. That's why it's crucial, even in the busiest settings, to say something positive and supportive to build trust. We can follow a simple three-step model. Praise what the mother is already doing well. Inform her gently with age-appropriate facts. Suggest a practical next step to support her journey. We call this PIS model, praise, inform, suggest. A small, well-placed comment can make a lasting difference to a mother's confidence. Let's explore how the words we choose can either build a mother's confidence or break it. In this slide, we will see how the same situation can be approached in two very different ways, leading to very different outcomes for the mother. In the first example, a health worker says, "You are still only breastfeeding your baby when she already is 6 months old. Don't you know she needs food now?" It may seem like a harmless correction, but it actually makes the mother feel judged and even embarrassed. She may start comparing her baby with others, especially if others are fatter or on formula, and lose confidence in her ability to feed her child. Now let's look at the second approach where the health worker says, "You have been exclusively breastfeeding your baby for 6 months. That's wonderful. It's really helped keep her healthy." So, here the health worker acknowledges and praises what the mother has done right. This small encouragement can significantly boost her confidence. Since the baby is now 6 months old, the health worker can then gently and respectfully introduce the idea of starting complementary feeding alongside continued breastfeeding. So you see how we say something is just as important as what we say. Kind, constructive words make a mother feel seen, respected, and empowered. This slide illustrates how a simple routine contact at a health facility can be transformed into a powerful moment of breastfeeding support. A mother may visit for something as routine as weighing or immunization or for treatment of sick baby. But instead of just providing the service and sending her off, the health worker can observe the mother-baby interaction and gently step in using the PIS model. Acknowledge and praise what the mother is doing well. Provide age-appropriate information about the baby's current needs and offer a simple, practical suggestion for the next step. This approach doesn't take extra time, but it leaves a lasting impact. The mother walks away feeling encouraged, supported, and more confident in her feeding choices. Here are a few quick yet powerful tips for health workers. Make warm eye contact, acknowledge even small efforts, and maintain a positive, respectful tone throughout. After all, every contact is an opportunity to build a mother's confidence. Let's make each one count. Now let's look at what happens when health workers don't say enough. Even a routine visit can become a missed opportunity if we fail to connect with the mother. In this example, Meena brings her 5-month-old son Arav for weighing. Arav is thriving, exclusively breastfed and has gained 800 grams in the past month. But the health worker completes the weighing in silence and just says, "Okay, Meena, thank you. Keep the growth card safe and return next month." What does this reflect? Does the response acknowledge Meena's effort? Did it reassure her or motivate her to continue exclusive breastfeeding? Would she feel it's worth coming back next time? This is the case of a missed opportunity, one where the health worker could have reinforced confidence and continued support. Here's how the same visit could be transformed into a more meaningful interaction. After weighing Arav, the health worker uses the PIS model. Praise by saying that Arav is growing so well, your breastfeeding is really working. Inform her that at 5 months, breast milk is still all he needs to stay strong and healthy. Suggest the mother gently to keep it up, and we will talk about soft foods next month when Arav turns 6 months. With just a few kind and informative words, Meena feels reassured, valued, and more likely to return and continue exclusive breastfeeding. As already said, every routine contact is a chance to build confidence. We should make the most of it. This slide shows how growth monitoring can serve as an entry point for effective breastfeeding counseling. Let's begin with the example where the 3.5-month-old baby who was exclusively breastfed until last month. But as the weather turned hot, her mother began offering water, thinking it would help with the baby's thirst. Since then, her weight gain has slowed down as seen on her growth chart. This situation offers a valuable opportunity for the health worker to apply the PIS approach and respond with empathy and encouragement. Begin by praising the mother's attentiveness by saying, "It's wonderful that you are so thoughtful about your baby's comfort in the hot weather." Next, inform her with relevant information. Breast milk already contains all the water your baby needs, even during very hot weather. Finally, suggest a practical next step by encouraging her to breastfeed more frequently when the baby seems thirsty rather than offering water, as this will keep her baby well hydrated and well nourished. We just saw that growth monitoring not only tracks a baby's development but also helps identify feeding issues early and guide appropriate counseling. For example, slowed weight gain may indicate a change in feeding patterns, such as when night feeds have been stopped. Breastfeeding is too infrequent or complementary foods are insufficient in quantity or quality. On the other hand, steady growth can reflect well-balanced feeding practices that should be acknowledged and encouraged. In each case, growth charts provide a valuable opportunity to support and sustain breastfeeding through positive, tailored guidance. Before I wrap up this session, I'd like to highlight one of the most effective ways to sustain breastfeeding in the community, which is peer support provided through breastfeeding support groups. Breastfeeding support groups offer mothers a space to connect, share, and strengthen each other. These groups may begin informally, perhaps among women attending an antenatal clinic in the maternity ward or within the community. Sometimes they are started by health workers or existing women's group and meet regularly in homes or community settings. With guidance from someone well informed, they offer reliable information, emotional support, and confidence building, especially for mothers who may feel alone. Such peer led groups help fill important gaps that formal health services may not address. This concludes session 12, breastfeeding, increasing, sustaining, and relactation. We discussed ways to boost milk supply, maintain it, and relactate after interruptions. In session 13, breastfeeding approach in special situations, we will cover feeding practices when mothers face conditions such as mental illness, hypothyroidism, diabetes, tuberculosis, hepatitis B, or HIV. We encourage you to continue sharing your thoughts, questions, and suggestions for future topics to help us better support your learning journey. Feel free to reach out via email at rajendragulati@hotmail.com. Your feedback is invaluable as we strive to create informative, helpful content. Thank you for joining us, and we look forward to continuing this journey together. Have a wonderful day.